YouTube, Dan the Dentist here. Today I want to talk to you about the virus. And I know you've heard a lot about it, but it's specifically how it affects dentistry, how it affects you, why we have our dental offices closed, and what you can do to address common issues that you might be having since your dentist won't be seeing you unless it's a true medical emergency.
I don't believe you.
Most dentists are shut down because it was a recommendation made by the American Dental Association. And the CDC also recommended as well. And then we started seeing local governments start making restrictions.
And I'm going to tell you everything you need to know about the miserable, screwed up world of local government.
And shutting down non-essential business. Although, even though dentistry is still considered essential business, a lot of the procedures that we perform are not essential.
Say what?
And that's hard for me to say because, it's not to say that I don't think that cavity shouldn't get a filling in there, but it takes a long time for cavities to form as opposed to other medical emergencies, which can be a matter of days as opposed to a matter of months or even a year. I'll start off by talking about what I consider a true medical emergency. So we're talking about obviously tooth-related issues, but things that can lead to swelling, infection. You might see your face swell out, you might get a fever, obviously associated with some pain, and we can't let those types of things linger. It's important to call your dentist. So dentistry is affected a lot because we use drills and ultrasonic machines, things that actually put water into the air, aerosols, and these little droplets can contain the virus, especially if it's coming from somebody that's tested positive, and you may have heard that people are asymptomatic and they're walking around out there with the virus, no one would know. But it's like we had to treat everybody like they have the virus.
Hey, are you sick?
Oh, no, I'm fine. I just have a little indigestion.
In your nose?
Yes.
And in order to protect our other patients and ourselves is to pretend they do and make sure everything is cleaned down really well. Now, we already practice a lot of this. It's called universal precautions, where we will clean down chairs and these rooms between patients. We wear protective masks, gloves, glasses, things like that. Most dentists are making changes around the office to help protect everybody. And we haven't really received any word yet as to what the proper methods are to protect ourselves, because there hasn't been enough time to come up with any studies or anything to show that's proven to be effective.
I don't know. I'm making this up as I go.
Obviously, patients are affected too. People are recommended at the very least to have 2 cleanings a year. So a lot of people are overdue. In my office, there's a huge backlog of people that we're going to have to make up for. And it's going to take a while to do that.
I've been saving all month for this. I think I need a root canal.
In the grand scheme of things, in terms of overall health versus a cleaning, obviously getting the virus under control is more important. However, there can be ramifications for not getting your teeth cleaned. So I encourage you to continue to brush your teeth twice a day for 2 minutes each. I'd like you to floss once a day. One product I recommend highly is a water pick. It's like a power washer for your teeth. You put warm water into a reservoir, and this water shoots between your teeth and around your gums to free up a lot of debris that builds up, plaque, tartar, food, and can keep those teeth from developing some gum-related abscesses or problems or pain or bleeding and things like that. So I want to go over a few things that I see commonly during dental emergencies that aren't necessarily true medical emergencies, but issues that need to be addressed soon by your dentist, and ideally once they open, something to address. But things that you can do in the meantime. The things I see most commonly are things related to gums, teeth breaking, and then fillings or crowns breaking. So with gums, it's usually related to bleeding gums or painful gums. So I was mentioning earlier the water pick. The water pick is great because it can really clean out stuff stuck in between the gums, which is something that often will lead to bleeding gums. So clean out plaque, tartar, and food. And to get that out of there won't necessarily solve any painful issues or even the bleeding for that matter for maybe a few days. After you've cleaned it out really well, though, that bleeding should start coming down.
I made a resolution to floss, and I did it. 12/01, January 1st, bam, blood everywhere.
So I would give that water pick a try. Make sure you're brushing like normal, and that you might notice that start going away on their own. One thing I see a lot is popcorn. Popcorn skin and kernels, they actually get stuck down underneath the gums, and they adapt so well to the teeth that they just kind of like get stuck under there, and they're like suction cups on there, and they can't be removed very easily. So I would encourage you basically not to eat popcorn in the meantime.
You serious?
And if you do, make sure you're flossing really well, brushing really well, water picking really well, and to get that out of there before it starts an abscess on your gums or gingivitis. I also see a lot of broken teeth. People will have these cavities underneath that weaken the teeth, and then the enamel just fractured off. You hear the cracking noise, and you can tell there's something crumbled out of your mouth. A piece of tooth is now missing. Your tongue goes right to it. It might be sharp. And the best thing to do in that circumstance would be to really clean things out well, go to the store and get some temporary dental filling material or dental cement. And I will link into the description below what I'm talking about. And it's like a white material that starts off kind of easily moldable like clay, and then you can actually place it yourself into the hole and then let it set up. It sets up with moisture, so your own saliva will set it up, and hopefully bring it out to cover any sharp areas too. And then make sure you test your bite your teeth together.
What has that got to do with it?
Back off, man. I'm a scientist.
Make sure that they come together normally, because you don't want to add that filling material and you add so much that when you bite down, you're just hitting on that filling material after it sets up. But if you bite before it sets up, then you will be able to get your bite to come down properly. Similarly, I see a lot of crowns coming off. Crowns are actually surrounding the entire tooth. You might see the tooth that's left over underneath there's not a lot left, or it might not look like there's a lot left. And you need to make sure that gets covered again for two reasons. One is because the tooth underneath can be really sensitive, and we want to cover that up, and the crown insulates. But the second reason is because the teeth on either side of that crown are going to want to start closing together. They'll close that gap in between there, and then if that goes for too long, that crown's not going to fit on top of your tooth anymore. And when you come back to have a dentist put that crown on there permanently, it might not fit right.
I have a very bad feeling about this.
That's not to say they can't put it on. We can do adjustments for it, but it's not ideal. So I would use some similar dental cement that you can get that I just talked about for the filling, and I would clean out the inside of your crown really well. I mean, try to make sure nothing is inside of there. And the same with your tooth. Make sure your tooth is really cleaned off well. It might be a little sensitive, and I understand that, but try to make sure that it stays clean, and then make sure that there's nothing stuck on top of the tooth, because you don't want to put that crown back on that tooth and then crush some kind of junk in between the crown and the tooth, and then start some other issues. And then you can take that same dental filling material, you can thin it out, or put a very thin layer, and use that material to cement that crown back on. Make sure you're putting it on the correct way. In fact, you might want to try doing like a try-in where you're practicing putting it on, because there's only one way for it to go on a tooth. If you flip it 180 degrees and try putting it on there, it won't go on there. So make sure you have it in the correct orientation. You might have to try that out a few times, and then cement it on there. And again, you might want to bite together. Make sure your bite's coming together correctly, because if it's not, you want to take it off before that cement sets, and not, because after it sets, you might have a really hard time taking it off, and you could cause some other problems trying to force it off there after it's already set.
And may the odds be ever in your favor.
Another thing you can try using is just toothpaste. Take just a little dab of toothpaste, put it on the inside of that crown, make sure, again, the tooth is clean, put it on there, and bite together, push it all the way down, bite together, make sure that your bite comes together properly. And that's not going to stay on very well. In fact, you need to be careful about eating on it, because if you have something especially sticky, it's just going to pop right back off again. But at least it's holding that space until you can go in and see a dentist. The other thing that we see is it could potentially be a choking hazard, which is a little concerning. You want to make sure it's really on there if you're going to go to bed with this, because you don't want to fall asleep and then have it pop out and then you inhale it in your sleep. That can cause some issues too. So be careful about that. Hopefully dentists are starting to open up in the next few weeks, and we can start addressing this. And I don't think we're going to be seeing patients, and dentistry probably won't be quite the same as it used to be. So you might be having to get used to new protocols that we're doing. Your dentist might ask you to stay in your car to wait instead of coming up to the waiting room.
Well, we're waiting.
Or they might take your temperature, or they might have a questionnaire for you. And they might deny you. If you have like a small fever, they might send you home. And I'm not in love with that idea, but it's in everyone's best interest, because this virus, even though it's not as deadly as they said it would be. It is very, very infectious, and we need to make sure that our office stays safe for the people that are most at risk, which are people with diabetes, high blood pressure, and the age of 65 or older. So thank you for respecting that. Thank you for watching the video. Let me know in the comments below if you have any questions. I'll try to answer them if I can, or if you have any topics you want me to cover for another video. Thanks for watching. Stay safe out there.